free since then, so for 27 years, and that has helped a lot. But also changing how I eat and what I eat. Not suggesting that everybody does that, but for me, that is what did end up working for me. Also cleaning out a lot of sugar, processed sugars in my diet. Not saying I'm perfect. There are times that I do consume sugar, of course, but I do try to stick to as much natural sugar as possible and try to help my gut heal in that way. In order to understand digestion, we need to kind of know a little bit about the anatomy of it. So I'm going to let you see my screen here for just a quick second. This is my wonderful artwork of the digestive system. And I know it's kind of blurry, but this is the brain, and digestion does start in the brain. When you think about food, you start recognizing that the smell, the sight, the thought, you do start salivating, beginning of the digestive enzymes. So then that goes to the mouth. And it's this process, to my scribbles. I am not an artist by any means. So then the rest of the digestive system is going through the stomach. And when going back to the mouth, when we chew, that helps with the mastication, the breakdown of the food to allow it to go into digestion. Well, when we don't take time to chew our food, then somehow that food needs to get broke down. And we can't just break down food. Our body has to work harder to break it down when we don't chew. So really, ultimately, the best thing to do is start by breaking it down in the mouth. Chewing your food even 20 times per bite, up to 40 times, depending on what kind of food you're chewing, really helps with the beginning phase of digestion. The rest of your body doesn't have to work as hard then to break that down. And how many times have you eaten a meal and you've forgotten what it even tastes like because you had to eat it so fast? So think about that when you're really chewing. You really want to try and get your food to baby food type consistency before you swallow. And I know that I'm a mom and a grandma, they call me Oma, to many children. So in order to get food on the table, answer all of their, can you get this? I need this, and all of that type of thing. A lot of time, moms are guilty of not having the time to sit and relax when they eat. And so we tend to eat fast and not chew our food because we usually have so many demands placed on us. So we need to really take time to sit and chew our food. When we get that food down to our stomach, that's when our gastric enzymes, our gastric juices start to break down that food. But our stomach does not have teeth. So we need to chew it first so that the food can get more easily broke down. Now, you've heard of reflux and all of that. Well, a lot of times that is treated by, medication because they think, oh, it's an acid issue. Well, honestly, it's a lack of acid issue. And it's not helped when our food comes into the stomach in too large of pieces, and our stomach really has to work even that much harder. Not to mention, we eat too much at one time. And especially here in America, we eat such large portions that we really are overdoing it for the amount of gastric secretion that is in our stomach. So smaller portions, or I should say normal portions, would be a better idea for our body. Then we go from there. All of this empties into the small intestine. Now we're not going to talk about how the liver and the pancreas, the gallbladder, all of that. We're looking at just the plain digestive system today. But as it goes into the small intestine, then this is where we get into even more trouble. Small intestine is singular layer lining, and it's only one cell membrane. in there, it has these junctions and they're supposed to be tight, but a lot of times they have the inflammation and they end up with these holes in these junctions. Anything that causes an issue that irritates this, they get lax or loose or irritated, and then they don't stay together. They get like more like a pulled apart. And that's where we find out that we get leaky gut. From there, that empties out into the large intestine, which is actually supposed to be for our waste. Now, our food is supposed to travel from our mouth to our output within a few hours. But how many of you know your transit time from the time you eat till the time you actually eliminate? For some, you think that it's almost immediate, like within 20 minutes, because you get this rush of diarrhea. That's most likely caused to one of the conditions. Others, it's several days that you go without any stool movement. And that is a whole other condition. And so transit time, or even tracking transit time, which we do have something that we can use to monitor that. And you don't have to swallow little cameras to do it. But we have a little program, it's called Blue Poo, that we can actually do if you're interested in figuring out your transit time. And that will help determine how well is your digestive system actually flowing. If you're interested in that, you can contact me and we can set you up with the Blue Poo experiment and you can see what your transit time is like. But anyway, the large intestine is used to filter out the toxins and get rid of your waste. And a lot of times we are not eliminating fast enough or at a normal rate even. And then when we do eliminate, we don't have the right amount, or not the amount, the right consistency, because it sits in our large intestine too long. So though that's just a quick rundown, not even very technical, wanted to keep it very simple for you. But I am going to share my screen. We're going to dive into some of the, so this is a lab form that I use when going through looking at what are some of the markers that we look at. So when we're looking at functional labs, the ones that we're going to look at in determining what is going on with your digestion is we actually look at your glucose and see where your blood sugar is. And you might think, what does blood sugar have to do with glucose? I thought that was pancreas or liver. And it is, but it also can be digestion related. Now, we also look at your albumin down here, this level right here. And if this is high or low, these are the functional ranges. Again, I am not the one that came up with these ranges. Dr. Datis Karazian, he's the doctor that did he's got all the letters behind his name, and he's the one that did all of the research and testing and has been all over the world and done all of that, and knows that these are where these values need to be to hone in and see where these values really need to be when people are going to the doctors and they're seeing normal test work come back, but yet still feeling really like garbage. And they are like, well, what is going on? This narrows things down and really can pinpoint better where these functional ranges can land. So low or high, we see some inflammation in the gut area. We also look at globulin when we're looking at the digestive system. We look at the ratio between these two. And again, if they're low or high outside of these functional ranges, then we know we have a gut issue. We also take a look at the liver, and we also do take a look at the cholesterol. So we would be coming over here and we would be looking at your cholesterol, because your cholesterol plays a part in your blood sugar, and it also plays a part in your digestive health. A lot of people think it only has to do with the heart, but your cholesterol has a lot to do with your gut health, and it can really tell a lot about what's going on in your digestive health. Then we'll come down here and we do take a look at your vitamin D level as well. And I know a lot of practitioners medical doctors don't know what to do with vitamin D. They don't even, a lot now, they're saying that if it's between 32 and 60, that's great. But we know as functional practitioners that if it's not up by 80 to 100, even if it's over 100, we're okay with that, because we know that that's where people perform their best. So that all plays a part in that. We also look at the CBC with the diff. Now, what does this have to do with gut health? Well, this has to do with gut health because a lot of times you will get, these labs will come back normal. And again, it's all going back to why. Why are you not feeling good, but your labs are normal? We know that this range here in the white blood cell, I'm going to write it on my board as you're looking at the sheet, is normal in the 5 to 8. But if it's high, of course, we know you have an infection, right, of some sort. We also know that the neutrophils are normal between 40 and 60%. But if they're high, then we know that there's a bacteria going on. The lymphocytes, if they're high, we know that we have something viral going on. The monocytes, if they're high, that's also something viral. Now, in the case of the monocytes, if you've ever had mono or the Epstein-Barr virus of any sort, they will typically be a little bit on the high normal side anyway, because once that's in your body, it kind of just camps out on that high normal end. But we're talking a little higher than that. We're talking in the 8, 9, 10, 12, even higher side. And then the eosinophils, if they're high, we know that we need to look at possible food allergies and possible parasites. And yes, we have parasites here in the US. There's parasites everywhere in the world. We just don't talk about them very much here in the US. And for basophils, we know that, again, if they're high, we know that food allergies or parasites. So why is this important to your digestive health? It's important to your digestive health because if you have any of these things going on in your system, it's going to affect your gut, because we do know that everything starts in your gut. These low-lying infections, and we're not talking if we see this show up in your blood work, we're talking these are low-lying. These are the blood labs that are going to come back and you're going to be told everything looks good. Everything is normal, because it's going to still come out looking just fine. Okay. So those are the labs that we look at and explore when we are talking about inflammation in your digestive system. So what does that look like? What do we do about it? There are many different things we do about them. Oh, the other thing we do look at too is we go over here and we look at your CRP, your homocysteine. We also will look at your free T3, which is right here, and the total bilirubin. And again, total bilirubin, ALK phos, the AST, the ALT, which are up here. Those are all ranges that are liver, but yet they tell a lot to do with the gut as well. Free T3, people go, wait a minute, that's a thyroid marker. Well, yes, it is. However, it's also a hormone marker and it is a gut marker, because T3 is a marker that the TSH, it's a downstream marker of TSH. So it actually is the command center. It's the communicator. So it sends out communication to the rest of the body. So it has a lot to do with your gut health. So when we see these markers, some of the things that we will do is, one of the things is we always go back to wanting to cleansing the system. And we do a cleanse, and then we go from there, and then we want to make sure all the drainage pathways are open. Now, we will talk more about that on Wednesday, and we'll talk more about the herbs again tomorrow. And once we do the senolytic cleanse is what we use, and that's 1 month, and that helps clear out, it helps repair and starts to clear things out to help restore. And then we rebuild the gut, actually giving it good, feeding that microbiome. I use herbs, and I do use some nutraceuticals, but they're herbal based. But otherwise, we use food as your medicine, and looking at a low inflammatory, low acid, low alkaline, because cancers and things like that, they cannot thrive in an alkaline diet. So things that are, or an alkaline environment is the word I was trying to grab off the top of my head. So we want to look at that type of lifestyle. Now, not saying that you need to stay there, but to look at foods from a different perspective when you are choosing foods that would help nurture your gut and make it a little bit happier. And you should have received a link to the Reclaiming Your Gut ebook. And on Wednesday, I will hopefully have another little ebook that you'll be receiving as well as a thank you. And if not Wednesday, you'll get it in the replay email that comes out. And that'll talk about good fats and why we need them. And anyway, just putting diet together, you want to keep alkaline and not so much acids. When you eat a lot of acids, it actually feeds any disease processes that you have going on in your system. When you keep things more alkaline, we find that disease just cannot thrive in an alkaline environment. So some foods that might surprise you that would be alkaline would be food like limes, lemons. People go, oh, they're very acidic. Well, outside of our system, yes, they are considered an acid. I mean, lemon juice will take off sticky residue off of a glass or off of a countertop or something. But when we ingest lemon, it becomes an alkaline base. A lot of people don't understand that lemon juice is very good for people that are told to have a lot of acid reflux. That is why you'll hear a lot of health practitioners saying drink lemon right away or before a meal, because it does help start getting your digestive enzymes going and actually even being produced, because it helps build acid by being alkaline. So kind of sounds counterintuitive, and yet it helps because we don't have enough acid. Anyway, that is how we look at the blood work. And those are the markers that we would be using when we're looking at how can we come along and support someone and really kind of dial in the needs, the person, come alongside them, not to diagnose. I don't do this to diagnose anybody. I'm not a doctor. I would never tell anybody to go off of their prescriptions without consulting their doctor. This is only for advisement and for you to take into consideration, but just to come along and support you in your wellness journey. As suggestions and help, I am a certified nutrition consultant and a functional health and nutrition practitioner, and obviously a certified bloodwork specialist. So when we're looking at digestion, we're looking at it from 4 Digestion is the center point, but we look at it from 4 other areas. We look at it from a microbial, what's going on with the microbiome part of the piece. How can we feed that microbiome? So we want to look at the bugs inside. Are they good bugs? Are they bad bugs? Because not all bugs are bad. We want bugs in our digestive system, but not all bugs are good. So it's getting that balance. It's called dysbiosis and symbiosis. So we want to be in symbiosis. So balancing that out, getting rid of the bad bugs, and then nurturing and feeding those good bugs to bring us back into that symbiotic state. So to do that, that's why we go through this cleansing period, and then we refeed that microbiome. Now, again, you can refeed that microbiome starting with like ferments. Ferments would be like kimchi, sauerkraut, miso, Greek yogurts, that type of thing. Looking at colorful plated foods, like eating the rainbow, going back to that alkaline type food base. Again, you don't have to do that constantly or all the time. For me, it was looking at a gluten-free lifestyle. That doesn't have to be for everybody. For me also, it was no red meat. That's not for everybody. So this is, something that is specific for each person in each situation. And then the other thing is mechanical. Oh, I talked about that with my very rough drawing. Is what is your transit time? And so figuring out how long does your digestion take from the time that you eat to the time that you excrete it. What is that transition time? And we have a way to monitor that without going through all of the tests. And that is by this blue poo that we can do. That all rhymed, didn't mean to do that. But anyway, we can do this blue poo experiment, which is all natural. It's just, we use blueberries in capsules, and we can check your transit time over a course of a couple of weeks. And it gives us a clearer picture. And then we also do a food, mood, poop journal with you. And that gives you a good idea of what your transit time is. And then structural, which goes into mechanical as well, because sometimes our structural, if you've had surgery, like for me, I do have a little jiggity jag kink in my large intestine. So there's that. So it does take a little bit difference. Sometimes people with different back issues or hip issues, things like that, they have a slower transit time too. But there are stretches and movements and things like that that can get you off of that roller coaster of being too bound up or in constant cramping pain. And then chemical. What is causing chemically your digestion? What is around you, toxins in your environment that's causing? What chemically are you ingesting? Also, the clothing we wear sometimes can also cause reactions in our system. So those are some other things that we consider when we are looking at digestion and those 4 areas that affect it. So that is another area, another way to look at what affects digestion. And again, most of the autoimmune diseases, and there's over 100 of them, or autoimmune conditions, there's 100 plus that you can name, and they're all affected. Digestion, so you clear up your gut and you can clear or reduce signs and symptoms of those 100 plus autoimmune conditions. So your gut plays a huge role in our lifestyle. If there aren't any questions for today, I wanted to give you a snippet and a piece and a look at the blood work and how I look at it from a functional lens, and why I can see something a little different than what a doctor would see in the medical office. Can see just a little bit more, dial it in just a little bit, and be able to walk a little bit deeper with my clients alongside them and their medical staff as a bridge, and maybe hopefully filling that gap that they were needing and wanting to help be a voice for their health journey.